So I might start with you, surprise, surprise, Leisa. If you could reflect for us on how the issues and solutions around menstrual hygiene management and sexual reproductive health are linked, to give us that big picture framing and your reflections on what you've seen and what works to get that integration happening.
Thank you, Rosie. Thank you, everyone, for having me here. It's lovely to be here. So we also have been struggling with this menstrual health, menstrual hygiene thing when I've been working with UNICEF. We've landed on menstrual health and hygiene. And a lot of that is to do with which sector leads and, all the kind of formal stuff. But a big issue that we found globally, number one, the most important thing is that there's government leadership interaction. And that government interaction leadership happens across sectors. So that we include WASH, that we include health, that we include education as the kind of three primary leads. And then as many other participants as possible, because once you get a national momentum on this, then things start to move quickly in some places, a little slower in others. And then the other big issue that we find with linking SRH and MHM or MH it's all fundamentally, the underlying issues are so fundamentally based on similar notions around gender and inequality. For girls, if you're not understanding where your period comes from and how it happens, then you're probably going to run into trouble with pregnancy later on. That's a definite thing. But boys, once they start to understand that relationship with men, then hopefully there's going to be a bit more of a conversation around sexual and reproductive health, and that's something that's going to come up a little later. Which is exciting. And I think as well, it's a safer entry point for SRH in a lot of countries. We have a lot of countries where you can't have this conversation around SRH, but MHM for some reason, or MHH, is a way that you can have a conversation with the government that'll lead into these bigger issues around sexual and reproductive health and health more broadly for women and girls, which is such a underlying issue for so many women and girls. It's not just the very core package around MHH and sexual and reproductive health, but it's that broader issue of health access and control. There's something that you can have a conversation with at very high levels, and suddenly there's an easier entry point for both sides. So that's the global idea that we've learnt. That's the things that we've learnt from.
Great. So really thinking about that government leadership and the entry points. So what sort of entry points have you seen
work? So I've just come back from Timor. I'm going to hear about that quite a bit. But also, I've worked a long time in East and Southern Africa. So the discussion with government, particularly in places like Uganda, Tanzania, Ethiopia, becomes suddenly much easier when we're talking about, oddly, periods and menstrual hygiene and cycles, and talking about how that health affects girls, particularly obviously coming into school. And then suddenly the discussion around, from our point of view, integrating those issues into education curriculum, integrating them into training for health professionals, into training for WASH professionals, becomes a lot easier, because you start to have it's a lot less threatening of a dialogue, speaking to government and to UN personnel and to NGO personnel when you're talking about menstrual hygiene, oddly, than, for example, the SRH conversation so directly. And so we found that's worked, particularly Uganda, where sexual education was such a hot topic over the past couple of years. Now we've had the First Lady step up, and she supports MHM, and she supports having a proper menstrual hygiene policy in the country, which has opened all sorts of doors then for health actors to come in and say, oh, and there's this other part to that we'd like to talk to you about. And suddenly things start to work. Yeah. Not suddenly, slowly.
So it would be great, as we're having this conversation, to really be thinking about, well, what does this mean for this question that we're asking ourselves tonight of actions that we think need to be taken to address these issues? So Loretta, Lisa's really touching a lot there on talking about periods as an entry point with government. Can you tell us about your work in Papua New Guinea and how you find talking about periods?
Sure, I'd love to. Hi everyone. So one thing I found interesting, what Leisa made mention, and I thought that I could share this with you, is the contrast between the acceptance of
Loretta, I'm just going to interrupt
yes.
you. Do you mind just speaking
a bit louder? Okay, I'll speak a bit
And you're welcome
louder.
to stand up as well, because some people might not be able to see.
Okay, great. So I thought I could share with you all how I found talking about periods in the different communities that we work in. And it's interestingly enough that I've observed that we found that those that live furthest out and in the remote places having a bit more of an acceptance and kind of want to know a bit more about what is the period, how does a woman get pregnant, than to those in the urban areas who have access to books and technology. And this is because, I say this because I've realized that the more that we talk about periods and the more that they're willing to listen, they can be able to actually link that, So, okay, fine, this is how a lady has her period, this is how a woman has a period, and this is how she would then get pregnant. And so, for a man, if he were to listen to that, he would then say, okay, so I understand this a bit more better, and so what can I do about it? And then that is when we can talk to them about safe sex and condom use and family planning. And then when we do, then they say, okay, so what's available there for me to use? So it's really speaking about what Leisa said as if you're like opening up the conversation first about how the body works, how the period works, so they can understand and then be able to make that informed decision about what they can do. And I thought that it was interesting that it's the ones that are furthest away that are more accepting and more willing to listen. And I'm not sure if it's the same in Timor, but that's what's happening in PNG.
That's really interesting, isn't it? And I can see a lot of people nodding, and I suspect we'll come back to that with questions and conversation. And it certainly is a recommendation in the report to really be thinking about and reaching out to marginalised groups, people in remote areas, women and girls with disabilities as well. So let's find out more about Timor. So Mana Novi, you're coming at this rather from the sexual and reproductive health, but more from a WASH in schools angle. So what are some of the barriers or challenges that you've had? Because it's not necessarily a WASH practitioner topic to be talking about periods and or sexual and reproductive health.
Thank you very much for the opportunity. If we talk about wars in Timor-Leste, there is really challenges in Timor-Leste. And if we talk about wars in school, I would say it is really limited to access to the school, access to wars. And if we link to the period, it is really hard to describe how girls they can manage their period during in the school without access to toilet, without access to water in the school. So this is the issue that WaterAid have been working for piloting in the some school to support how girls can access to the WASH facilities, even though there is still like about 10% improved WASH in the school in whole Timor country. So it is really big challenge in Timor-Leste. If we talk about how to manage period during the school time, it is really hard to talk. How girls they can change during the period in the school if they don't have access to water. If there is no separate toilet between girls and boys, how they can change, how they can manage their period. So WaterAid, we've been work together with the Mary Stops in implementation and try to address how the facilities, WASH facilities in the school can support girls to present in the school. At least they have a separate toilet and they can access to water even though there is not like all day access, but at least they can access to water and they can manage their period. About the taboo, I want to say that if you talk about menstrual health, there is still like lots of taboo in Timor. Yeah, when we talk about taboo, there is like really lots of restrictive attitudes that girls and women face based on the culturally. Oh, you can during your period you can take bath, you can wash your hair. How you can get hair issue if even during your period you can wash yourself. So this is. And the institutionally, there is still a lot of taboo, as my experience last year when we will celebrate the second Global Menstruation Day in Timor-Leste, and we need to work with the Minister of Health that time, and we tried to put in the banner, say, Global Menstruation Day, and Minister of Health said, no, you can't. Why you put menstruation? That is like, that will embrace, embarrass women and girls. They feel like, women and girls will feel ashamed because of the menstruation word. And we try to advocate and raising awareness, and then suddenly we get called from Minister of Health to explain about why, because this is the hard thing, secret or something we can't talk openly. So we need to, we try to engage Minister of Health, and we explain both Menstops and WaterAid. We explain to the Minister of Health about the issue, and then finally we get the situation. But in the implementation in the school, there is still, actually WaterAid role is to promote about the menstrual health issue, and often the boys and girls, they ask about the what happened with the after girl get the period, then they often not want to close to the boys or men. Why that happen? And how become a pregnancy? That lot of question to WaterAid, so we find like it is difficult for us practitioner. We have limitation knowledge about the sexual health reproductive. So this is the good opportunity that WaterAid partner with Menstop. So WaterAid implemented the WASH project and menstrual health, and Menstop support on the raising awareness on sexual health reproductive in Timor.
Great, thanks, Novi, and what a great story around, challenging story. Not great, it's great. I'll tell you what's great. It's a challenging story around that institutional discrimination and taboos, and yet this year what's happened for Menstrual Hygiene Day?
Yeah, so this year, that's more like, that's the result from last year. So this year is more, Minister of Health is the lead for this celebration, and that's the great result that we find. So today there is an exhibition in the near the beach. So our main guest is the First Lady of Timor-Leste. She gave the great speech to girls. So the participant today is all the girls and youth. So First Lady always gave her message about what do you want to choose. If you want to choose your future, better future, then you need to understand about menstruation and why is menstruation. After menstruation, what will happen? You might get pregnant, and you need to be understand well. Or after you get your period, you will get like children, and you will stop, and your future will just like as a mother. That's a really great speech. There's something like hard to hear, but for Timor, that we feel like there is motivation that's after girls have, because if we talk link to the marriage stop, explain about family planning or condom promotion in Timor is really restricted to talk about this, and because of the religion, because of the culture, so we can't talk about this. So yeah, that's great to have partnership for the staff.
That's why it turned into the great story. And it is a great example, again, what's called on in the report for that really joint advocacy of these shared goals and shared challenges that we have. So, Chris, coming to you and thinking about Marie Stopes, tell us how menstrual hygiene management, menstrual health fits into your sexual and reproductive health agenda and your priorities for Marie Stopes.
Sure. I think we're starting to hear it come through in the other panelists. But so first of all, Marie Stopes, of course, maybe not of course, but I'll tell you, is a very focused organization. We work on family planning and we work on providing safe abortion services. It's kind of what we do. And we work at scale to do that. So last year, about 27 million women in the world were using family planning from Marie Stopes. So, we're really proud of ourselves on that, and we think we're doing a great job. But where we're not doing a great job is reaching younger women and adolescent girls in particular. We've never sort of been able to crack it. So, we're looking at in many different ways to do a better job of reaching the unmet need for family planning in that demographic. Menstrual hygiene makes a lot of sense. I think it's something we never really thought of until very recently, until this partnership really. We've heard about some of the ways in which the entry points are similar. These are taboo topics, sex and menstruation. The way you open up that conversation, which is very difficult to do, but once you've done that, you would do well to talk about both things. You're talking about the physiology for one thing as an entry point, and you're opening up a really difficult conversation, but a really vital one. So, I think that's where our interest is coming from primarily.
Great, thanks, Chris. And I heard you saying earlier when we were talking about this that PNG is one country which has got a different trend.
Yeah. Globally, as I said, we're not doing great in reaching adolescent girls. Our sort of percentage of family planning adopters tends to be much lower than the percentage of women of that age group. But that's not the case in PNG, where it's pretty close. Sort of about 12, 13, 14% of our family planning clients are adolescents in PNG, which is really interesting. That in many ways predates, the work we're doing now, but I think there's kind of learnings both from what we've been doing prior and from what we're doing now to improve, bring that to other countries. Yeah.
Loretta, you were talking a little bit earlier when we were walking here about an experience you had, I think it was in Madang, around these entry points that Chris is talking about, of talking about periods can get you into a conversation about sexual and reproductive health, family planning.
Yeah, so this is an experience we had with one of our teams in Madang. They went on outreach to a remote district that didn't have any government health services for about 30 or so years. And the patrol that we did together, it was a joint outreach patrol that we did with one of the community-based organizations that's based in that district, the Kumura Foundation. Vincent Kumura is the head of that foundation. He's based there in the district, and he has been, for a few years, if you like, doing a lot of good community awareness work with the communities on different topics. And we were able to join up with him and go to that particular village that we went to. And it was interesting after we had the awareness sessions and the talks and how we do our awareness, talking about the period and how a woman gets pregnant with our anatomy aprons on and our flip charts, and it's a very
Has everyone seen the Marie
session.
Stopes aprons? Yeah.
No, it's a pretty
Fabulous.
cool one.
Open it up in your uterus. It's right there.
It's a quick one. But it's really cool. We have the female anatomy in front and we have the male anatomy at the back. So
Really confuses me.
yeah. So we show exactly what is happening as a process in the body, and we had since it was the first time that anyone ever went there, the whole village was actually present, and they were there and they were willing to listen. They were into it. And at the end of the day, we had about 12 parents bring in their young adolescent girls for services, and all of them got the 5-year implant. So there's a lot of different approaches, and then, as we mentioned, we're looking at ways in better approaching young girls, and I guess talking about the period, talking about the processes, how a young woman can get pregnant. That actually opens up a lot of things for people. You know, they can piece things together and they can say, okay, well, maybe this is what I can do to help my younger daughter. And so, yeah, it was that experience that we had in that particular place.
Wow, still getting over the 30 years since.
Yeah. You'd have to, that place is for experienced hikers. In fact, I've got a trip planned there next month, and
Wow.
I just have to prepare
I might be over next month.
I think you've got a few people coming with you,
prepare
Loretta.
myself, honestly. Yeah.
Now, I've got a few more questions which I'll throw in as we go, but I know that there's such an amazing wealth of experience and reflections, and I'm sure you've got questions for our fabulous panelists as well. So can I ask if there is anyone with a reflection, a question, and when you are asking or reflecting, can you also say your name and where you're from, just to give us a little bit of context? Please, Glenda.
I had one for Leisa.
Sorry, so Glenda, you're from...
Glenda, I'm from Growing Cambodia, which is a very small Phillip Island-based organisation. And I joined that organisation because every cent they raise goes to the children of Cambodia, and we teach English over there. And like everybody else's organisations, we've got involved in all sorts of things, which includes days for girls, kits for the girls, and if you don't know them, that's for their period, to enable them to be able to go to school. We've got 4 schools that we teach English at, and we've delivered them to those girls. Sadly, the percentage, this figure has yet to be confirmed, of the girls' ongoing use of them is not that good. Some girls have buried them because they're covered in, we've taught them to wash them. But I think that we've got to do a lot of work on instructing the girls, and there's a lot of overload of information, I feel, for them to absorb at the time. But Leisa, I was going to ask you, used an acronym. You said that they were quite happy to talk about periods.
Yes.
But not something else.
Sorry, not so happy to talk about sexual and reproductive health.
Okay.
So it's kind of for a lot of particularly Catholic countries. So Latin America, we run into this trouble a lot in lots of parts of East and Central South Africa, and also places in the Pacific. The conversation around sexual and reproductive health is so difficult with government, and I'm thinking from kind of government level. To even approach it is just such a long process. So a bit of a shortcut that we've started to use in a lot of places where the UN is working is to team up with UNFPA and start the conversation around menstrual hygiene, particularly since Menstrual Hygiene Day is now such popular. We've got International Day of the Girl, we've got Menstrual Hygiene Day, and then you've got IWD. So it's kind of International Women's Day, sorry. So it's 3 points we can have an easier conversation with government about how to then build in both the menstrual hygiene work, which then leads to a conversation about puberty, which then leads to a conversation about sexual and reproductive health. And we found that's effective in places like Uganda, Tanzania, Ethiopia. It's worked very well. Lots of countries in Latin America, and it's starting to happen in quite a few countries in the Pacific as well.
Great. Thanks, Glenda.
Can I just ask Chris one as well? Chris, we are doing this through very young women at school, like high school girls, that type of thing. But with, like at CM Reap was Albright University, would that be more the area that you would target rather than high school? Or
In terms
what's
of
the audience that
what's the audience we try to reach?
Yeah.
Any and everyone who is of reproductive age. So we sort of have a few different methodologies, whether we have a clinic-based service delivery system or mobile outreach, or there's a few other things. So we would use different methodologies to reach different people, but anyone with an unmet need and planning falls within our catchment area. And so, university absolutely, and I guess high school is sort of where we're trying to go, where we haven't really been before.
We were hoping we target maybe an equal here to sort of grade 6 to year 1 of girls, but hoping that they'll tell their mothers, and you know, like obviously when they take this kid home, but I'm just not sure that we've educated them enough for them to be able to deliver a message to the rest of the family.
Well, I would love to put you in touch with our team in Cambodia.
Great connections being made. Leisa, can I ask you to jump in here and on this piece around education, girls knowing about their menstrual health, the role of family from your research in the Pacific on the last taboo?
It's really interesting to hear that periods are an easier entry point than sexual and reproductive health. I think that's really interesting. And it makes, I mean, from the work that we did in PG and Solomons and PNG, certainly the school-age girls that we talked to were very, like they wanted to know all about everything. So they were certainly very open to it, and it wasn't parents that were, it wasn't the girls that were a barrier to hearing more. It sounds like it was more the community attitudes and the parents and what kind of sits around them. Working through education makes a lot of sense. I'm not sure.
It's fine. I'm happy with where you. Well, I was thinking about one of the key recommendations that I was remembering from the last taboo was around access to.
Well, one of the key recommendations is around community-based education, so really taking menstrual health beyond schools and recognising there's now a generational gap where younger girls sometimes have better knowledge than their parents, and that can cause issues and challenges.
Right, Phoebe.
I want to segue the question. I'm Phoebe, and I work for the International Planned Parenthood Federation, and I previously worked for Murray Stokes and was involved in some of this initial formative research, so it's really nice to see this come to life. My question is around your new joint program, and I wondered, because my interest area for this research is particularly around, as you said, women who've not had any formal education in school, that missed generation, and how your joint approaches, particularly in community outreach, are working. Are you doing anything in terms of awareness raising through joint engagement, maybe in Timor, with WaterAid and Murray Stokes teams together, and if so, is it working?
Great. Can I hand that over to Novi and Loretta?
Okay, thank you, Phoebe. For this working together, actually in Timor-Leste experiences, we do both in school and also in community. So in the school, yes, we are working together in the implementation about the raising awareness on the menstrual health and sexual reproductive health message in the school. From the experiences, so the first, when we talk about the sexual reproductive health, it seems like sensitive issue that most of the girls feel like, what is? They feel like nervous or shocked in the first time. So from that, we try to planning, like we start with the menstrual health information in the first, and then in the second meeting, we ask the girls and the boys if they want to talk about reproductive health issue. Then we will come together with marriage stops and some present from the health, like nurse, that they can explain about this in the school level and also in the community, to work with mostly with women and men. To discuss about this issue, we always make a separate discussion between boys and girls, or men and women first. Otherwise, men and boys will dominate to talk about the woman. Like, women need this, girls, you need this, that. So we need to make a separate discussion between girls, women, and men and boys, and then we bring them together to get their idea to share all that raising awareness knowledge.
Yes, so for PNG as well, we've also realized that the more information we give to the young girls, accessibility to service is something that we need to consider as well. And a part of them being able to access the services is their community support, if you like. And a big barrier to that is the parents themselves, the community leaders themselves. So we're thinking now to be being a bit more engaging the communities a bit more in the whole conversation, so that when the young people do decide, the young girls do decide to come for services, there is already that awareness and that understanding and support that they can get from the community to come forward to get the family planning services that they need. So there is already activities that we're trying to do to address those, and having sensitization workshops in the communities among the leaders and all of that, so that we can address that aspect of it. Yeah.
Sorry, just one little point about that. Health systems are a great way to access girls who aren't in school, because at some point during their lives, girls are going to need to access a health system, whereas they're not necessarily going to be sent to school. So one big global opportunity at the moment is the Hpv Vaccination Rollout. And so the fact that Hpv is being rolled out to this particular age of groups, girls that we want to reach for both MHM and sexual and reproductive health, is a fantastic opportunity for the development of these HPV plus programs, where you have girls coming to health centres, getting information about the MHH blah stuff, sorry, and sexual and reproductive health, and then getting referrals to services that can follow up on both. So that's something that's kind of being explored globally at the moment.
Right, and a great one for us to take into that regional conversation. Leisa, did you?
Yeah, so I just had a question for Novi. So, sorry, my name's Leisa. I'm working with the Australian Red Cross at the moment. So when we did the last taboo research, a lot of the taboos that we heard were related to women's fears of causing bad luck to the men. You know, whether it's bad luck with their hunting or fishing, or their physical strength, their fighting. And I was just interested to hear about the taboos in Timor-Leste and what the kind of underlying reasons are for the taboos there.
Yeah, the main thing is people call menstruation is woman's sickness, moras feto. Moras feto is our word. They're like a woman's sickness, and also often they mostly about the attitude about like they not allowed to take part or to wash their hair, and also they are not during their period they can like close to the men or boys, and that's all the taboos. And like about the food things, about like how they eating food, maybe some restricted food that they can take, mostly all I think Mana Zoana, Mana Jos was there who did the research on the menstruation in Timor-Leste. So maybe you want to say some taboo, please. Just more.
Thanks, Mana Novi. Did it in partnership with WaterAid though. I mean, it was a small research piece that we did with collaboration with Menstrual Health, and this was a few years ago. Mana Novi, what year was it? 2015. 15. Yes, and it was in 3 communities, but it was done with a consultant, a Nanu, who worked with us on it as well. And it was interesting research. There was a number of different findings, and I left before we were able to look at it with the Ministry of Education, but I remember there was a number of findings where we actually wanted to get some entry points into the curriculum in education department. But I'm just trying to remember. I think for us, one of the biggest things that came out was that there was quite a difference between young women and older women around their periods and what they use, what products they use. and that seemed to be changing a lot. But we were also looking very closely in terms of looking at disposal practices and with what kinds of toilets each household had as well, so from quite a wash perspective.
Yeah.
But one of the key things was that was quite interesting was that it was the whole fear for women and girls to go out it was around the fear of staining. So that was the biggest issue. But for young girls it was changing because they were using sanitary napkins that could be disposed of. And that was quite related to from memory, that was quite related to their freedom in terms of movement and being able to move around. Whereas for the older women who still were using, generally speaking, henna or cloth.
Clothes, all clothes.
There was more fear of staining, so there was less likely to go out. But it seemed to be that the mothers were the ones who really, and correct me if I'm wrong, none of you, but seemed to be quite strong in saying that their daughters need to stay at home around that time because of this fear of staining. And there seemed to be that intergenerational change that was starting to happen as a result of using different products.
So maybe that's a piece we can come back to on products disposal. Yeah, Patricia.
Just as the conversation's flowing, there's a couple of things that have crossed my mind, and it's kind of been touched on. Sorry, I'm here in my own capacity, but I'm also from Duke University, so I've done a PhD, a reproductive health study with girls who've been trafficked in the sex industry in Nepal. And this whole topic of menstruation and the taboos has come up very heavily in my research study. So sorry to not quite leap into that first, but I think the thing that's I just want to reflect on and toss into the conversation is the religion aspect of it, because in Nepal it's Hinduism. I just wonder, when you were talking before, Novi, as to whether religion has come up in relation to menstruation taboos, and also the role of women. The role of women in terms of being the keepers of the traditions, in terms of menstruation taboos.
Great question, thanks. Yeah. Reflect on religion and also for you, Loretta, as well.
Yeah, for everyone here.
Yeah, in terms of the religion, I mean, in Timor-Leste, it is like about more than 90% are Catholic. So, like everyone, when we talk about menstruation, when we talk about sexual, reproductive health, and when we talk about all about like women, they feel like, oh, this is against the religion law, and so that's why you can't talk this. Even from the experience, like many of girls in their first monarchy, they don't have information from their mom because of these culture and religion laws. Yeah.
And that's finding from my research as well.
Yeah. What about from a sexual and reproductive health perspective, religion, Chris, and also a topic that we've touched on?
No problem.
No problem. No problems at all. Another topic that we've touched on.
Sorry.
No, that's fine. Another topic that we've touched on, and being the one male in the room who's not here with a job as photographer, the role of men and boys as well.
Yeah. Sure. So we had an exchange earlier on this, so that's where if you're picking up on anything. From Marisop's perspective, in our family planning work, it's very important to engage with men and boys. It's done differently, obviously, in different cultures and in all the different countries we work in. But there's no question from our perspective, we. Insofar as men are gatekeepers for family planning, or are potential uptakers of vasectomy, then we want to engage them, and we put a fair amount of effort into that. Yeah. But I'm aware there are other perspectives. More specific to menstrual hygiene than family planning.
Yeah, definitely. Should I say them now?
Yeah, well, Novi did touch on before that it is important, to engage men and boys in the conversation. But Leisa, your challenge was if you've got a number of resources, where do you put your effort and your priorities? So do you want to draw out that conversation for us?
There's two big points to me. So I'm a gender advocate, that's what I do. I've been a gender advisor now for a very long time. And there's two parts to this that I always try and emphasise when we talk about men and boys, because obviously we love them and they're very important. But the results for women and girls, when you talk about menstrual hygiene, and when you talk about menstrual health, and when you talk about sexual and reproductive health, the impact of that falls entirely, almost entirely, on women and girls. And so it's part of what we do is to empower them, to give them their rights and their kind of access to services that they basically need, because the impact is so devastating. Like a girl who has a period stain at school may never go back to school because she is so ashamed of that, and that affects her entire life. So you've got to balance out a couple of different things. Obviously, inclusion of men and boys is very important. Explaining to them what you're doing is very important. I was in Tonga years ago. We had an emergency response. We brought hygiene packs and we're handing out to girls, and all the guys came up and went, well, what about us? And we said, well, this is what we're doing. Exactly. We were like, do you know what's in here? There's no. So we told them, and they went, oh, okay, fair enough, and they all left. Because I think a lot of the time the conversation is that this is a need and this is why we're responding in this way. Because I need. The other thing is this idea of men and boys as gatekeepers, which I completely understand, but what we don't want to do through any programming ever, I hope, is to reinforce their position as gatekeepers, because it is not up to men and boys to give us permission to access our health and our reproductive needs or our menstrual needs. It is up to them to understand that men and women are different, we have different health needs, and they have no right to stand in our way when we need them. And I think a lot of the programming that I see, not from most Hopes, obviously, who are wonderful, but from other organisations, reinforces that idea of men and boys as gatekeepers, and that is not what we should be doing. We fundamentally have to start from a kind of a feminist and a rights perspective when we talk about these issues. That's fine.
So we were in vigorous agreement. That was great. Dottie, please.
It's actually a beautiful segue into the question that I want to ask. Di Kilsby, Gender Social Inclusion Consultant on a number of things. In particular, at the moment, along with my colleague Joyce, we're the Gender and Social Inclusion Consultants specialist on the Water for Women program. And I was just really interested when Rosie and others were talking about the name that you came up with at the beginning. I know that
you want to turn it into an acronym.
Don't worry, but you're both rights-based organisations, and we know that the issues are much more than just health issues. So I just wondered. I mean, I'd like to think about, I'm just in the mood for marching on the streets about everything at the moment. But why don't we talk about menstrual rights?
Yeah,
in the same way that we talk
it's a really good question.
Social and reproductive health and rights. Yeah. Because it's much more than just the health and hygiene.
Well, we already changed it once today, so.
It's too late.
So what are the thoughts that are triggered there? Chelsea?
No, I was actually going to ask the panel from a global perspective if people have heard of that.
Yeah. So it's definitely a conversation that's happening at the global level. The issue is, though, for a lot of organisations, if you call it something like rights, no sector takes responsibility for it. So part of the planning around this is thinking what sectors have money and access and resources to do this work. And health, for example, is a massive sector where there's a lot of work being done, at a certain level. And then education is another one where there's masses of money that things can be done. So part of it, and the rights conversation is not an attractive conversation in a lot of circles. So a lot of it is around positioning this in a way that's going to be both effective and attractive, certainly at the global kind of conversation. And both sides are right. I mean, it is a rights question. It's a question of rights. It is a question of hygiene. It is a question of health. So how do you name it so that it captures that cross-sectoral, cooperation that we need?
Loretta's got some ideas.
Yes. So this is what I thought I could share with you what we're trying to do in PNG to address the rights conversation. We had a project back in 2015, which was funded under the Danish government called Rights at Every Level. And that project we were asked actually by the government after we had passed the first family planning policy in Papua New Guinea, and this was like, sorry, I should speak a bit louder, should I? So the project, so I'll start all over again. So this project was called Rights at Every Level. And we realized that for us to be able to talk a bit openly about people's rights, we needed to actually get the people that were the focal entry points to support that individual person's right. So we decided to do in this project was to disseminate the country's first family planning policy. And this family planning policy came about through the family planning working group that we had in PNG, which Mari Stopes is the chair of the committee. And we have other stakeholders, the National Department of Health, other people in the SRH space that are part of this committee as well. And we were able to work with the government and finally get the support in recognizing that everybody had their individual right to have access to information and services for family planning and sexual and reproductive health. So we were able to launch those two policies, the family planning policy and the sexual and reproductive health policy, in 2014. We were asked by the government to, obviously they had no money, so we had to print the policies for them. And then we were asked, and we were like, sure, that's fine, so long as we have our logo at the back, you know, we're more than willing to do that. So we had the policies printed, and then we said, so what can we do about this policy? And this is something that in Papua New Guinea, policies get made up at the top level, but they never, told or implemented and shared with the community. So we decided to do sessions or workshops with community leaders, health workers, and what was the other group? Yeah, so those are the two groups, the community leaders and the health workers. And we took the values clarification and attitudes transformation approach that Mari Stopes uses widely in abortion. We kind of flipped it to young people's rights to accessing family planning information and services. So we redid the whole model, and we put more activities into values clarification activities on young people, why young people are vulnerable, why, what puts them at most risk of what they do, and how they can be able to help themselves, and where these people come in to help them. So as health workers, we have in the policy their responsibilities as well to be able to provide for them that information and that service that they're required. There's a section in the policies as well that states the community responsibilities, what they should be doing to supporting SRH and family planning programs. So we were able to do that over the course of the project, over where Mari Stopes were. And we found very good positive responses. We got the Catholic Health Services on board on some of the workshops as well. And we had a breakthrough in the Central Province where they said, you know what, thank you, we'd like to have you come and provide services in our area. So we are gradually addressing that rights aspect through these little projects that we're doing, and we keep on trying to disseminate the family planning information and the rights information to particularly the people who matter the most in giving that service to the people. So it's the health workers and then the community, their roles in the support systems, as we mentioned before. Young people can come forward, but then they need that support system to be able to access that service. So I thought I would share with you our experience in PNG, what we were doing along that scope.
Wonderful. Yeah. Loretta, unfortunately, sorry. Unfortunately, we just have one moment left for Novi. Did you want to share as well?
Yeah, actually, regard to the man Joe Smart was mentioned about menstruation in Timor-Leste will add to the curriculum. Yes, it is. So at the moment, menstruation is a part of the curriculum in the primary school. So they start with the grade 4, 5, and 6 So there is like resources about the flip book that to break all the taboo. So what girls can do during the period, what So that's all our stuff. And for the washing school guideline being approved by the council minister and together like WaterAid and Menstrual, we start with the dissemination in 2 municipalities and then we'll continue. Actually, we had the sector workshop to disseminate about the washing school guideline and also the sector workshop about the curriculum and about the resources that are used for the menstrual hygiene promotion in the school.
Great, thank you, Mananofi. And we will be hanging around in here, so there'll be plenty of time to continue the conversation. And Leisa, Chris, Novi and Loretta, you've just given us so much to think about from both the global perspective, the sexual and reproductive health perspective, and your very grounded experiences of really trying to make this work, this linkage between WASH and sexual reproductive health. And for me, as I've been thinking about Menstrual Hygiene Day, I was walking yesterday with my niece, who's 13, and talking to her about being period proud and being period day to day. I know. And talking with her, and for me it's been a real learning journey as well. I didn't know. I mean, I quote stats all the time about children dying from diarrhea being the second biggest killer of children under 5 is diarrhea, but I did not know, and I do not share enough, that the leading cause of adolescent girls' death, as I understand it, is from adolescent pregnancy. And this work for me that we're doing, where we can keep girls in schools, ensure that they get accurate information, get pregnant later, give birth later, is saving girls' lives. And that is, our shared goal, that we want to keep girls in schools and we want to stop our girls dying unnecessarily. So it's been a wonderful panel discussion, and I know that this is not the end. This is the start of the journey of really thinking about actions we can take together. So please join me in thanking our wonderful